So Dr. Blanchard is going to come, and again, he's very passionate about what he does, and I'll try to keep him reeled in. He says he'll only be about 10 minutes. We'll see if he holds up to that. But welcome my partner, if you will, Dr. John Blanchard.
Thank you, Keith. Thank you, everyone, for coming tonight. As Keith said, I'd like to spend a few minutes talking about the new era in healthcare. The past 7 years has seen unprecedented changes in our healthcare system. And we really are in a new era. We've seen the passage of the Affordable Care Act. We've seen the employer mandate, the individual mandate. We've seen rising premiums. We've seen supersized deductibles. We're seeing tremendous consolidation among hospitals and healthcare providers in the healthcare system. And they're really forming these healthcare conglomerates, these big healthcare conglomerates. Essentially, over the past 7 years, we're moving away from a personalized individual healthcare system to a public institutionalized healthcare approach. I could speak for hours about all the characteristics of the new era in healthcare, but tonight I want to focus on something that is personal and something that impacts every single one of us in this room. You see, in the new era of healthcare, we have to answer two very important questions. The first question that we have to answer is, who am I going to trust with my care and the health care of the people that I love? Who am I going to trust? The second question that we have to answer is, how am I going to receive that care? We have to answer the who and the how. Because in today's healthcare system, in the new era of healthcare system, we have a lot of choices. And choice is great, but folks, we have to be educated consumers. We're consumers now in this new era of healthcare. In the past, it was really pretty easy when we were trying to think about answering those questions. The who was our primary care doctor, and the how was going to their office. But as I said, today we have a lot of choices. So let's first talk about the who. We have a growing shortage of primary care physicians in our country. We have doctors that are retiring early from primary care, and we have new doctors that aren't going into primary care. That means access to a highly skilled primary care physician is increasingly becoming more and more difficult. Increasingly, we're seeing primary care delivered by nurse practitioners and PAs. And I think we're also in the marketplace seeing some confusion about the term doctor and physician. The other day I was looking at an advertisement, and the person was saying that they were a naturopathic physician. And for the life of me, I couldn't figure out what that meant from the advertisement. So I called the office, and it turns out they were a chiropractor who was treating all sorts of medical conditions with nutrients and supplements and vitamins. So I think the term doctor and physician today isn't as clear as it was in the past. I think in the past when we used those terms, people generally knew what that meant when they were talking about a healthcare professional. And so that's something that we have to do. We have to figure out who is it that we're going to trust in today's healthcare system, and we have to be educated consumers. Does anybody know how many years does it take after a bachelor's degree? How many years of formal training does a nurse practitioner and a PA have before they can practice? Can anyone answer that question? 2 years. Yeah, good. The 2 times I did this, nobody can answer the question. How about a physician, a primary care physician? How many years of additional training do they need before they can practice medicine? 7. Pretty close. So again, we have to be educated consumers. We have to know what it is that we're buying in today's healthcare system. So that's the first question. Who are we going to trust in the new era of healthcare? The next question is how. How are we going to access healthcare? And again, there are lots and lots of choices. Today you can go on the internet and see and have a consultation with a doctor who doesn't know you, who can't examine you, who can't do any labs or diagnostic testing, but will render a diagnosis and a treatment. We're seeing medical clinics popping up in pharmacies. We're seeing them, even Walmart is getting into the business of healthcare now. You can go to Walmart and get medical care there. These options are as convenient as fast food, but in my opinion, they're just as dangerous. We have to be educated consumers. Another option is to see our primary care doctor. But increasingly in the new era of healthcare, it seems as if doctors have less and less time to spend with their patients. So that's the second question that we have to answer. How are we going to access healthcare in this new era? And these are big questions. These are not small questions. We're not asking, who should be my mechanic or who should be my plumber. I mean, these are big questions, and they're questions that can, in some circumstances, have life and death implications. And the answers to these questions impact our health. And there's nothing more important than our health. So we should try to get these questions right. At Premier Private Physicians, we believe that access in healthcare is everything. We believe that there's an ideal model of primary care delivery that involves a direct relationship between the patient and the physician. This ideal model is called, as Keith said, concierge medicine, or another name is direct primary care. And we believe that the ideal model of primary care practice has three critical components: time, communication, and a relationship. These are three critical components that are necessary in order to deliver an ideal model of primary care delivery. Folks, it starts with time. Time is the currency of excellence. If excellence in healthcare is our goal, we must spend time on it to achieve it. And for a physician, that means time with their patient. Time to communicate. If you talk to any doctor, they'll tell you that it's the history component of what we do. It's talking to the patient that allows us to arrive at a true diagnosis and a true treatment plan. But that takes time and it takes communication. And the final component is a relationship, and we think that's vitally important, a relationship between the patient and their physician. This new era in healthcare is upon us, and unfortunately, these three critical components, time, communication, and a relationship, are increasingly difficult to find in this new era of healthcare. So the decision is yours. Who are you going to trust, and how are you going to access the care that you need in today's healthcare system? And I hope that Dr. Washi can answer that question for you as she goes into more detail on this concierge medical model that we've developed. And I really appreciate your time and your attention tonight, and I look forward to answering any questions that you might have after Dr. Washi's presentation. Thank you very much.